Good evening. My name is Brian and I am the lung coach. And today I'm here to talk to you about my COPD home study course. I've decided to make this home study course because I've treated so many heart and lung patients in the hospital that I've realized that preventative medicine is truly the way to go. Once you're in the hospital with heart and lung disease from COPD or smoking cigarettes, a lot of times it's too late. And I've had to pull many patients off life support because of COPD or heart disease caused by smoking cigarettes. And while this is not a smoking cessation program, this is more of a COPD management program. We'll talk about COPD in relation to quitting cigarettes because that is the first thing you have to do to stop the progression of the disease. So we will talk shortly about smoking cessation, but there are many good programs out there. I will talk about a few of them, but number one thing is you have to quit smoking cigarettes because the COPD will continue to get worse. And I'll talk about the symptoms and signs of COPD. If you're a smoker and don't have a diagnosis yet, you may have some of the signs or symptoms. So if you or a loved one is a smoker or has been diagnosed with COPD, or you've had a heart attack and you're a smoker, this program is for you. Please invest the time and energy to go through the videos and educate yourself so you can better manage your COPD. Now, I'll also talk about what exactly COPD is and how we define it. I will talk about the COPD Gold classification, how healthcare workers define it, and I'm also going to talk about a lot of the symptoms I've heard patients tell me they experience with COPD. So we're going to go into depth on what COPD is, but we're also going to talk about how to treat COPD, what treatments they do in the hospitals, what treatments they do outside the hospital on a regular basis. I'm going to talk about not only the medications they use, but I'm also going to talk about the equipment that is used. And I'm going to talk about what treatments are appropriate at what times. For example, many COPD patients take their rescue medications on a daily basis. I disagree with this because it can reduce the effectiveness of your rescue medication. A lot of times you need to be on a maintenance medication, so I'm going to go into great detail on the medications. I'm also going to talk about some of the equipment. Sometimes you'll have to be placed on equipment in the hospital that can be very scary, like something, a BiPAP machine or a life support machine called a ventilator. So I'm going to talk a little bit about those things that may happen if you have COPD. And I'm also going to talk about some of the research for new therapies that are coming out. While there is no cure for COPD, there is lots of many great and exciting advancements. One of the things they're doing is stem cell research to regrow your lungs. So I'm going to talk a little bit about that. But in reality, COPD is more about management and prevention, quitting cigarettes, and then also doing something called pulmonary rehab or pulmonary rehabilitation. So I'm going to talk about how exercise and nutrition and counseling can help improve your quality of life and improve your breathing and improve your activity level, because that's what I want for you. I want an improved quality of life. And the number one goal of this program is to keep you out of the hospital as much as possible. So in reality, when you get to the hospital and you meet someone like me, the situation can be dire. But if you start working now, you might be able to prevent that from happening. So please take the time to invest in this program. Or if this is for a loved one who's a smoker, watch these videos because I'm going to talk about it, and you may not think you have COPD, but there are a lot of people with undiagnosed COPD out there, so this program could be for you as well. Now, I also want to talk about how if you get to a point with your COPD where it is not a good outlook, and maybe it's time to start talking about end-of-life care and hospice care. Now, while I've worked in the big hospitals treating attacks for COPD, I've also had another job doing hospice care, end-of-life care in homes and hospice centers. And I'm going to talk about some of the equipment they use in there. and some of the end-of-life decisions that you want to make before you are in the ICU at the hospital. Because that is a tough place to be, especially with your family. A lot of times, you're on life support and you can't make decisions. So you don't want to get to that point. So I'm going to talk about some of the advanced directives that everybody who has COPD should have to help ease the transition on your family and yourself. Don't leave that burden on them. Or if you're a family member who has if your family member has COPD and you're watching these videos, I'm going to go into some great detail on how to manage hospice care and some questions you need to be asking yourself or your loved one. So please check out that video towards the end. And also, me and my co-founder Annie, who you're going to see in some of the videos, we're going to do a workshop very soon where we come and do this live and answer questions and get a lot of groups, small groups. So if you're somebody who would like to come to those workshops, we're also going to include some of that information at the end of the course there. So join us if you or a loved one has COPD or is a smoker. Please invest in these videos and spend some time learning about the disease so we can help you prevent and manage it to improve your life, because you only get one life. Well, as far as we know. But let's take care of this one. Let's work on getting you back to a point where you can enjoy the activities you love. And I hope this information is useful to you. Once again, this is for educational purposes. This is not to replace the advice of your doctor. I always encourage you to have a good relationship with your doctor because you need them to manage your COPD. Thank you in advance, and please email me with any questions or concerns at hearttolungs@gmail.com. And thank you for joining me, and breathe easy. Good night.